Hello, Mr. Jones. How are you today?
Good. How
My name is Kara Gilson. I'm from the University of St. Augustine. I'm an occupational therapy student. I see you came in recently to our hospital. You had a right CVA. Is that correct?
I'm not sure what a right CVA is.
Okay. I think you're having a stroke, and you recently had some open heart surgery. Okay. Mr. Jones, I'm going to take a seat here. Your doctor recently ordered a occupational therapy evaluation so we can address the symptoms that are keeping you from doing things you want and need to do.
Okay.
I see you need to follow some sternal precautions because of the recent open heart surgery. Are you familiar with your sternal precautions?
No.
Okay, so I'm going to go over them. So we don't want you to push or pull anything. We don't want you to carry anything over 5 pounds. So that would be equivalent to like maybe like a gallon of milk.
Okay.
Maybe something a little bit underneath. And we want you to be careful getting in and out of bed and sitting up, sitting from standing. So we're going to be going over that today. And stretching your arms out to the side. So reaching for things this way. Do you have any questions about that?
No.
I also see that you need to receive nectar consistency liquids at this time.
Okay.
So absolutely no water. Are you familiar with that?
No.
What's happening right now, because after your stroke, you're having some weakness in your with your throat muscles and swallowing. We don't want you to choke. So the thickened consistency allows things to go down safer, so you won't be choking on anything. And I also see in your chart that you have orthostatic hypotension. Do you know what this means?
No.
So what this means is that any sudden movement from laying to sitting and rising up to standing, your blood pressure can drop extremely low. So today, when I start moving you around during the evaluation, I have a blood pressure cuff here, and I'm going to be monitoring your blood pressure closely. Okay? You doing okay so far? So what I'm going to have you do first, we are going to sit up on the edge of the bed. So I want you to show me how you can sit up on the edge of the bed for me. You can just scoot over a little bit. Okay? Are you feeling okay? Okay. I'm just going to look at your blood pressure really quick. Make sure your blood pressure hasn't dropped. You're going to be looking at it on your right side. Looks good. Blood pressure is reading normal, so everything's so good so far. Take this off here. Okay, so I'm going to be asking you some questions, Mr. Jones. Do you know who I am? Okay. Who am I?
You're the therapist.
Okay. Do you know where you are?
Hospital.
Do you know what time of day it is?
4 o'clock.
Do you know why you're here?
Open heart surgery, stroke.
Do you remember who brought your breakfast this morning?
A nurse.
Good. Can you stick out your tongue for me? Can you stick out your tongue and touch your nose with your finger? Can you stick out your tongue, touch your nose with your finger, and pat your head?
No.
Do you remember what you had for breakfast this morning?
Some liquid.
What are the steps you take to perform brushing your teeth?
Go to the bathroom, turn on the water, squeeze the toothpaste onto the toothbrush, and brush my teeth.
Can you recall your first grade teacher's name?
No.
If you had a doctor's appointment at 9 a.m., and you woke up at 8:30 a.m., what would you do?
Call him and tell him I'm running late.
Oh, good. Sometimes when we're in our kitchen, this could happen to anybody, and we drop a glass on the floor and it breaks, what do?
Clean it up.
Good. Can you repeat what I say? Jean loves her dog Java.
Jean loves her dog Java.
Do you wear hearing aids?
No.
Can you close your eyes for me?
Mm-hmm.
Can you tell me which ear you're hearing that from?
The right side. The left side.
And now you can open your eyes. Do you wear glasses or contact lenses?
No.
Okay. Can you tell me what time my watch says?
3:45.
I'm going to draw a shape in the air. And can you describe it to me?
X. H. 0. O.
Okay. Are you experiencing any double vision?
No.
Can you turn your head to the right?
Mm-hmm.
Can you turn your head to the left?
Mm-hmm.
Can you bring your head up, look up, and then down? Are you having any dizziness?
Mm-hmm.
Okay. Can you read the clock on the wall over there?
3:45.
Okay, good. Okay, can you follow my pen with your eyes? Okay, good. Okay, so I'm going to stand next to you. So I'm going to stand on the right side of you. I want you to describe what color this marker is.
Blue.
Okay. So I'm going to have you describe the color of this marker.
I can't see it.
Okay. You doing okay so far?
Mm-hmm.
All right. You're not feeling dizzy sitting on the edge of the bed?
No.
Okay. So I'm going to place my hand in front of you. I want you to tap my hand with your right hand. Okay? And now with your left. Okay, good. So I'm going to have you close your eyes. And what I'm going to do is I'm going to touch one of your arms, right or left. And you need to describe to me if the touch is a dull touch or a sharp touch. Okay, so go ahead and close your eyes.
Mm-hmm. Dull. Sharp. Dull. I think you touched the left side. Dull. Sharp. Sharp.
Which side am I touching?
The right side.
Okay.
I think you just touched my left side.
What's the what was
Mm.
the what did it feel? Sharp or dull?
I couldn't tell. I think you touched my hand, my left hand.
Sharp or dull?
I can't tell. Left side?
Sharp or dull?
I don't know.
Okay, good. You can open your eyes now. Okay. So what I'm going to have you do is I want you to close your eyes and you're going to stretch both your arms out and bring them back. Okay? So go ahead and close your eyes.
Forward or
Yep.
sideways?
Reach forward. So close your eyes.
Mm-hmm.
You're going to reach both arms out like you're reaching for something
Mm-hmm.
on your counter and then come back. Okay, one more time. Reach both arms out and back. Okay, you can go ahead and open your eyes. Okay, I'm gonna give you this ball. I'm gonna place it in your right hand. I want you to bring it over to your left hand and back to your right hand, and back to your left hand, and then back to your right hand, and then hand it to me. Okay, good. Okay, so again with the ball, I want you to squeeze down on it with your right. Good. And I'm going to have you squeeze on it on your left. Oh, I see that's very hard for you.
Mm-hmm.
Are you having some edema in this hand?
I'm not sure what that means.
Some swelling?
Mm-hmm.
Yeah, some puffiness. Has that started since you had your stroke?
Yeah.
Okay. Well, we're going to be addressing that later on today. All right, so I'm going to be looking at some of your movements through your upper body. The first thing I want you to do is I want you to raise your shoulders. So raise them like a shoulder shrug and come down. I'm going to look at your strength. I'm going to test your strength on this right side. So what I want you to do is don't let me move yet. Okay?
Mm-hmm.
Same on this side. Don't let me move yet. Good. Okay? So we're not going to be looking at your shoulders today. All I want, because of your sternal precautions, we want to adhere to them. But the only thing I'm going to have you do is I want you to reach your right arm out, come back, and then your left arm. Okay, good. Next, we're going to be looking at your elbow. I want you to bend your right elbow, and then bring that down, and then bending your left elbow. Okay, so. Don't let me move you. Don't let me move you. Okay, same thing over here. Don't let me move you. Don't let me move you. Okay, good. So now we're going to be looking at your forearm area. I want you to rotate your hand up, rotate your hand down. Okay. Now I want you to do the same on the left. Rotate your hand down. Rotate your hand up. Good. Okay. I'm going to be testing your strength on this side. So don't let me move you. Don't let me move you. Okay. Same thing on this. Don't let me move you. Don't let me move you. Okay, good. All right, now we're going to be looking at the wrist. So I want you to bend your wrist this way and that way. Okay, we're going to do the left. Get in and then go out. Okay, good. So, don't let me push you back. Up. Bring your wrist up. Don't let me push you down. Good. Bring your wrist up. Don't let me push you back. Bring your wrist up. Don't let me push you down. Okay, good. Okay, so now we're going to be looking at your hand. So with your right, I want you to go ahead and squeeze my two fingers. Good. And squeeze my two fingers. So what I want you to do with your right hand, I want you to hold it just like that. Fingers. Oh, fingers down like that. Straighten them. Okay, don't let me move them. Don't let me move them. Okay, same with this. Don't let me move them. Don't let me move them. Okay. Last thing I'm going to have you do is I want you to touch your thumb to your pinky. Same on this side. Okay, good. All right. Now, are you having any pain anywhere?
No, not really. It's a little up here in my chest.
Are you having any pain in that left arm?
A little bit, yeah.
Yeah. What are you rating your pain at 1 through 10?
Probably about an 8.
Okay, an 8. So we're going to be addressing that. I'm going to let nursing know and your practitioner or your physician know. And let them be aware of this, and we'll be addressing that later on in our evaluation. Do you have any wounds or open cuts on yourself? Okay. Okay, so what we're going to be doing next, I'm going to be looking at your balance, starting in the seated position. So I'm going to be testing your balance while you're sitting. So if you can place your feet on the floor, okay, and then just drop your arms to the side, okay. And I'm not going to be hitting your sternum area because of your sternal precautions. Okay, you ready? Okay, are you doing okay?
Mm-hmm.
Okay, so we're gonna stand up and I'm gonna do the same test. I'm just gonna put this gait belt around you, a safety belt. So just in case you lose your balance while we're doing this test, I can use it to grab you and safely just take you back to the bed. Do you have any questions so far?
No.
Okay, before we stand up, I just want you up here to your sternal precautions. So I want you to kind of gently wrap your arms around your chest. And then I'm going to have you stand on up. Forward, stand up. Okay, good. And you can just drop your arms to your side. Okay, you ready?
Mm-hmm.
Okay, good. Okay, go ahead and cross your arms around your chest and slowly sit down. Okay, good. Are you doing okay? Having any dizziness?
A little dizzy.
Okay, let's check your blood pressure too, because we did stand and make sure there's no drop. Still looks good. Okay, so next what we're going to be doing is we're going to be practicing our transfers. I'm going to set this chair up. I'm going to just see how you do with transferring over here. This will also simulate your toilet that eventually we're going to practice transferring in your bathroom. And as well, it's going to simulate having the elevated toilet seat above the toilet. So that'll help you with adhering to your sternal precautions. Did you have any questions about that?
No.
Okay. So again, brace your chest. I'm going to have you stand up. Are you having any dizziness?
No.
No. Slowly walk over. And when you feel the chair on the back of your legs, go ahead and slowly sit down. Okay? And then you can drop your hands to your side. Are you doing okay?
Yeah.
Okay. All right, next I'm going to have you, I just want you to show me how you eat with a fork. Okay, good. And I want you to show me how you brush your teeth. Good. And I'm going to give you this washcloth. I want you to show me how you bathe your upper body. Okay, good. Can you show me how you bathe your lower body? You get to your feet. Okay, good. Thank you. Okay, so what I'm going to have you do is I want you to put on this jacket for me. Just put it on for me.
I think I can use my arm.
That's as far as you get around.
Mm-hmm.
Okay. So go ahead and just slip that off for me. Okay, so that'll be something we definitely need to be working on. All right. And can you show me how you put on your socks? Okay, you doing okay?
Mhm.
Okay, so now what we're gonna do is we're gonna stand up and we're gonna transfer back over to the bed. So what was the first thing I told you to do before we stand
Do
up?
the sternal precaution.
Yep, and you're just gonna wrap your arms around your chest. You're gonna slowly get up. Yep, and take some slow steps over and slowly sit down. Okay, I'm gonna take off this gait belt and I'm gonna have you lay down now for me. Doing okay, Mr. Jones?
Mhm.
Okay. So you have a call bell here next to your bed. Can you locate it for me?
Mhm.
Okay. And can you tell me how you use that?
Push the button.
Okay, if you need to. Very good. Okay, so after completing your evaluation today, Mr. Jones, I've come up with 3 goals that we can work on together in occupational therapy. Mr. Jones, I would like to work on your left arm, your left upper extremity strengthening, because I'm seeing that you're having a lot of weakness,
Mhm.
and you're also presenting some edema in that hand.
Okay.
So why I would like you to work on it is to help you complete your upper body dressing and maybe your lower body dressing, and maybe as well your bathing. So we'd like you to get back to doing that task independently. Is that something you would like to work on
Mhm.
with us here in occupational therapy?
Yeah.
Okay. The next thing I'd like to work on is, I noticed as we were doing some of the visual testing, is some of your left side neglect, that you're having some issues with seeing things on the left side. So I'd like to work on some visual scanning abilities, maybe where because you're having issues with your vision on that side, is having you learn to turn your head and
Mhm.
learn to use compensatory strategies during performing any of your functional tasks. Maybe if you're doing some functional mobility or you're transferring over to the chair. So is that something you'd like to work on? You're finding that was kind of a difficult thing for you today? And then and the final thing I'd like to work on is your balance. As soon as I stood you up, you were presenting some inconsistencies with your balance. So working on that, we'd like to work on that in conjunction with your ADL transfers, getting from bed to chair or bed to toilet, or maybe even into the car, working on the transfers, and maybe even going into the bathroom and standing up the sink and doing that safely. Do you have any questions on your goals?
No.
Is that something you'd like to work on with
Mhm.
us? Okay, so we're gonna give you we'll be giving you the opportunity to improve your abilities, and I will see you in the mornings after breakfast for occupational therapy to practice and address these new symptoms that are interfering with your ability to do things you were doing before. Okay, did you have any questions so far?
No.
Okay. I have a little homework assignment for you while you're in your room here and you're not attending therapy. What I'm going to do is I'm going to give you a sleeve, and what it's going to do is simulate doing your dressing tasks and working on your active range of motion with your left arm. So what you're going to do is you're going to be using your left arm primarily, and you're going to take this sleeve and you're going to be dressing and putting it on the right side primarily. So I'm going to demonstrate it to you. So you're going to put the sleeve on, moving this arm, bringing it all the way up as far as you can go, and then taking it off. And I'd like to have you do this, at least try to do it maybe a couple times, and then we can increase into about 15 times, okay? I'd like you to demonstrate that to me. So using your left hand.
It's about as far as it will go.
Okay. And then you're going to be taking it off. Okay. So start out with just maybe doing it a couple times a day and start increasing it every day, okay? So you can be working on, you know, trying to put on your shirts, your coats, and then trying to get that arm to move actively and start strengthening it, okay? Is that something you can work on?
Sounds good.
Is it, it's not gonna be too difficult for you?
No, I think they'll practice, build up the strength.
Okay, good. I also wanted to tell nursing, your nurse, Charlotte, that we're trying to reduce your pain and your edema in that left arm, because you were telling me you're in a lot of pain, and I see you're having some edema in the hand. So throughout the day, nursing's gonna come in and they're gonna position your arm in your shoulder scapular region to create, you know, comfort in the arm, and see if we can elevate the hand so we can get some of the edema and get some of that swelling to come down. So they're going to be doing that throughout the day. So this, you know, again, this is going to reduce some of your edema and create comfort in this arm with the positioning. Okay, does that sound like it would be something that you can work on?
Yeah.
Will work for you. So finally, I just wanted to go over some discharge recommendations so we can anticipate your discharge. Say it comes tomorrow morning, or it comes the next day, or it comes in a couple days. So what I'm going to recommend, I'm going to recommend some equipment, some durable medical equipment in your home, which will include that elevated toilet seat like I discussed with you, so you can adhere to the sterile precautions, and that will be placed over your toilet, and as well a shower chair, because you had told me before that you had a walk-in shower and you were just standing up to take a shower. So now by placing a shower chair in there, you can safely take showers at home without losing your balance.
To sit on the chair.
To sit on the chair, yes. How would that be for you? You think it would be good? I also wanted to recommend some services that are out there for you and your wife. There's a great stroke awareness support group here in the hospital, and they meet every Thursday at 10 a.m. And I think that would be a great opportunity for you and your wife to attend, so you can get some information about your recent diagnosis and any other services, and meet other people that have gone through the same experiences as you. So how does that sound?
Sounds good.
Yeah?
Yeah.
I know you were even into bicycling, so maybe you can find out about some adaptive sports programs that you can get involved back into with bicycling.
Okay.
And I also, finally, I just want to recommend, I'm going to be recommending home health services, because I know you want to go home, and to continue with your occupational therapy within the home, so they can work on things like getting you into the shower, maybe moving around your home, getting into the kitchen, doing homemaking tasks, maybe getting back into your laundry, or maybe just even walking your dog. So, do you think that would be okay for you? Okay, good. All right, Mr. Jones. Well, thank you for working with me today.
Thanks for coming
and we'll be seeing you in the morning,
okay, great.
right after lunch.
Good, thank you.
All right, bye-bye.
Bye.